today. So here at Kronos Body Health and Wellness, you perform hormone replacement therapy on your patients. Is that correct?
It is. Honestly, I opened this business about 8 years ago and did not ever intend to bring hormones into this business. This is something that started about 5.5, 6 years ago. And it was basically a journey that I took. What happened was that in my mid-40s, around 45 years old, I began having all the symptoms of low testosterone. And with that, was looking for help, trying to figure out what was wrong with me. I had no libido, I had no energy, I had a gut, I'd gained so much weight and just was exhausted all the time. And I found that when I wasn't working, I would wake up and wonder why the hell I wanted to get out of bed. And so I checked my testosterone level and found that it was 384. Well, that was within normal range. The way that we are trained as physicians is to look at the number, the lab value, and compare it to the reference range, the normal reference range. If it is within normal range, then it's normal, and that's not the problem. That is what I believed at the time. And I thought, well, what's going on? Am I getting depressed? What's happening to me? Why is my body changing? Why is my life changing? Why do I have less interest in everything? And by chance, I happened to meet someone who changed my life. There was a man who was in the New Orleans area, and I met him at a function, and he was a gynecology endocrinologist. He was a fertility doctor. And somehow, after a few glasses of wine, he and I started talking about my issues. And he told me, you have to pay attention to your body, not the number. And he changed my life. He started treating me with testosterone, and my whole world changed. Everything came back. All of the function, the libido, my boldness, my strength, my desire to live again. And so from that time on, I started trying to learn, why is it that I taught one thing through medical school and yet I'm feeling something completely different. So I started traveling to lectures and reading and absorbing all of the research and literature I could, but never really intended to treat anyone. And then I opened this clinic, this wellness center, and it was really about all of the things I love to do. Having, a fitness center, massages, facials, all of the aspects of my life that I did when I traveled or when I was trying to take care of myself. But I did not intend to bring hormones into it. But as things go, I felt like I knew a lot more than many people in our area and many physicians in our area. So somehow I, one at a time, started treating patients and found that I was getting amazing results. And here we are today. And now I'm treating hundreds of patients, and they're doing really well. And I'm seeing amazing changes in people, just like I had.
But initially you were trained as an emergency room physician, is that correct?
That is true. I am a certified emergency medicine physician. I do have a background in internal medicine. I will die doing emergency medicine. I love emergency medicine. This hormone replacement part has just become my hobby. It was my life. It is what happened to me, and I am amazed at what I can do in helping other people improve their lives and feel so much better.
So I want to back up for a second. Earlier you said your levels or your testosterone levels were within normal range.
Yes.
There's a lot of controversy out there that states, especially within the practitioner community, that if you are within normal range, you don't have a gonadal or you don't have a testosterone problem. What are your thoughts on that?
Yes. I mean, that is something everybody needs to think about. What happens to us as we age? Our hormones, especially testosterone, human growth hormone, begin to decrease year by year. And as they decrease, you begin having symptoms. The symptoms we talked about earlier: increased fat tissue in your abdomen, decreased muscle mass, decreased cognitive function, decreased libido. All of this slowly begins to happen as your testosterone decreases. So yes, it is a natural part of aging, but it can be improved. Now think about this. I have heard that there are endocrinologists out there that say, this is terrible. You should not treat people with testosterone if their testosterone is within normal range. And yet they are treating patients who are men who want to transition to women and women who want to transition to men to make them feel better in their own skin. There's nothing wrong with that. So what is wrong with taking a man and making him more of a man, or vice versa, making a woman feel more like a woman? By improving and optimizing their hormones, it works and it is safe.
So when a patient comes to you with these symptoms or concerns of these symptoms, how do you approach a new patient in your clinic?
Well, first of all, when somebody calls to make an appointment, we have a visit, telemedicine or an in-person visit, and discuss their symptoms. It is very important to me that everyone is treated like an individual. So we discuss the symptoms the patient's having and determine if maybe they might be associated with lower testosterone or hormones. Then we'll check their levels. If the levels happen to be lower and the patient's symptoms do suggest they could be correlated with the low testosterone, then we talk about treatment. Now, this is something that has to happen between the patient and myself. I don't tell people, you need to be treated. I tell people, this is what I'm seeing, and this is what you could potentially expect. We discuss it together as a team and make a decision together. Once we decide if the patient might want to try being treated, then we start the treatment, and then a few weeks later, check the levels to make sure that the dosing is correct. And that's when I will contact the patient again, and we'll have a discussion about how he or she is feeling.